Many countries have already started giving a booster shot to their citizens to boost their immune system against more transmissible coronavirus variants. But Southeast Asia is facing much more difficulties. Many countries in the region rely on Chinese vaccines due to the short supplies of Western products and have low vaccination rates of less than 10%. They're also battling a record-breaking wave in new cases and deaths, led by the deadly Delta variant. Chinese vaccines have played a vital role in immunizing people of Asia against COVID-19, with millions receiving either a Sinovac or Sinopharm jab. But the countries using their vaccines, Sinovac and Sinopharm, now questioning the effectiveness of their vaccines. Hello everyone, welcome to World of China. In today's video, we are talking about an interesting topic. Are Chinese vaccines useless? What do the world and reports say? To know, stay tuned with us and make sure to hit the subscribe button. In recent weeks, anxieties have grown about the effectiveness of Chinese vaccines, as the infections are rising among medical workers despite being fully immunized with Sinovac shots have drawn already fragile healthcare systems. Countries including Bahrain, Mongolia, Seychelles, and Chile, where Chinese-made COVID vaccines were widely used for vaccination programs. Now they're noticing an outbreak in the rate of infections. This scenario is despite the countries getting about 50 to 68% of the residents fully vaccinated, higher than the rates of the US and Israel. Now, some Asian countries which made Chinese vaccines the most vital plan in their immunization programs have announced they will use other jabs. The move has raised questions about vital things, not only about whether China's vaccines can be trusted, but also about its attempts at vaccine diplomacy in Asia. Thailand declared it was switching its vaccine policy. Instead of taking 2 Sinovac shots, citizens will now get a mix of Sinovac and AstraZeneca. Healthcare workers who are already fully immunized with Sinovac will also get a different jab as a booster shot. Indonesia announced a related move, saying it was giving Moderna booster shots to healthcare workers immunized with Sinovac. And Malaysia announced it was switching to Pfizer's vaccine after it finished its Sinovac supplies. The concept of mixing vaccines to boost efficiency is not fundamentally new. Scientists are currently considering similar methods for AstraZeneca's vector vaccine, and the Russian vaccine Sputnik V also consists of 2 immunities with separate vector vaccines based on different adenoviruses. The developers hope that this will guide them to greater efficiency. Both countries which have seen gradual rollouts of their vaccination programs have been battling new outbreaks. Thailand is now reporting record-high numbers of infections and deaths, while Indonesia, the new epicenter of COVID in Asia, has seen overcrowded hospitals and oxygen shortages. Now, let's take a look into the companies producing Sinovac and Sinopharm COVID vaccines. Sinovac is a private company producing COVID vaccines. Sinopharm is another state-owned firm. The international trial has reported both vaccines are about 50% efficient in preventing moderate to severe COVID symptoms. 3 of the vaccines, 2 from Sinopharm and 1 from Sinovac, are inactivated virus vaccines. They're based on a long-established technology used in vaccines for viruses like hepatitis B or influenza. China is practically incapable to test the efficiency of its vaccines in its own country because very few cases of infection occur as a result of the strict lockdown measures. Research is dependent on studies led in heavily affected countries such as Brazil. These COVID-19 vaccines do not reach efficiency levels as high as Moderna, which have over 95% effectiveness. They're still more effective than some influenza vaccines, which only achieve efficiency levels of 30 to 60%. But if we take a look into international clinical trials, Sinovac and Sinopharm's inactivated virus vaccines are 50 to 79% effective in preventing symptomatic COVID infection. And they're still highly efficient in preventing COVID hospitalizations or deaths. Studies found Sinovac's job was 100% effective in Brazil and 96 to 98% effective among Indonesian medical workers. The fact that there are still diverse breakthrough infections in fully vaccinated people could be due to several factors. One is that the Chinese vaccines, like many other vaccines, may fade in effectiveness over time. Another is that the clinical trials had smaller datasets compared to real-world infections. Especially in Indonesia, it's witnessing soaring daily infection numbers in the tens of thousands. It could also be due to the more contagious Delta variant, detected in 60% of current cases in Indonesia, and 26% of cases in Thailand's capital Bangkok. There's no public data yet on the Chinese vaccine's ability against any of the COVID variants, but preparatory researches have suggested that inactivated virus vaccines like Sinopharm and Sinovac could offer 20% less protection against the Delta variant than facing the primary virus. No vaccine is fully effective in preventing COVID infection. Chinese vaccines are not 100% effective. They're still protecting many lives. Experts accent that breakthrough infections do not mean vaccines are useless, as immunization helps to stop people from getting very sick with COVID-19. In this case, Indonesian doctors admit that Sinovac may not be the best vaccine on the market, but for now, that is all they have, and that is better than nothing. And Singapore stated that people who received the Sinovac shots are excluded from its count of total vaccinations due to a lack of efficient data for the vaccine, especially against the contagious Delta variant. However, suspicions on the effectiveness of Chinese vaccines threaten to ruin China's so-called vaccine diplomacy, through which Beijing has attempted to improve its diplomatic influence around the world. China has exported hundreds of millions of doses of locally developed COVID-19 shots overseas. As the region that's got the most number of Chinese shots, Asia has been a key linchpin in China's vaccine diplomacy strategy. More than 30 Asian countries have bought jabs or collected donated shots. Indonesia is one of the biggest buyers of Sinovac vaccines in the world, has ordered 125 million doses. China's zest to sell or donate vaccines has been an attempt to switch the tail away from the fact that infections were first detected in Wuhan and to prove that it's a scientific powerhouse. When richer countries monopolizing many of the early orders of other vaccines, many countries in Asia, especially poorer ones, welcomed the Chinese jabs. These countries' standard thought was that some protection is better than no protection, even though at the time of efficiency data wasn't great. Like Thailand, it had initially depended on a local firm owned by the king to provide the bulk of its vaccines, but the sluggish delivery timeframe pushed the state to seek other sources after fresh COVID outbreaks this year. Besides, locally produced AstraZeneca vaccines ended up relying on Sinovac's job for now because the Chinese firm was one of the first to deliver. To date, over 100 countries have adopted Chinese vaccines. The first batch of vaccines to appear in many developing nations are from China. They refer to the Chinese doses as timely rain. Thailand and Indonesia's intentions to switch to other vaccines could potentially affect the model of success, bursting the bubble of the effectiveness of Chinese vaccines, and in effect, calls into question the technical prowess of China. At the moment, both Thailand's and Indonesia's governments are handling mounting criticisms over their slow vaccination rollouts and worsening COVID situations. In Thailand, the outrage is fueling by a leaked health ministry document quoting an official who opposed giving medical workers a Pfizer booster shot as it would prove that Sinovac can't give protection. There is an escalating number of people who reject Sinovac, who believe it's not effective. There's a big distrust in the Thai government, and the vaccine issue has become massively politicized. The Chinese government has yet to explain this whole situation. But remember, in the past, they emphasized that its vaccines are effective. And well, that's all for today. Thanks for watching the video. Give this video a big thumbs up and let me know your thoughts in the comment box. For more exciting videos, subscribe to this channel and hit the bell icon for notifications. I'll be back with another exciting video soon. Till then, check out our channel for more exciting videos and stay tuned.